Flu season. Getting a flu shot has always been an important part of staying healthy, and during the COVID-19 pandemic, it's more important than it has ever been. Common symptoms of COVID-19, fever, cough, congestion, shortness of breath, are similar to symptoms of the flu. Getting a flu shot certainly decreases your chances of getting the flu or makes the flu less severe if you are unfortunate and happen to get the flu. At the same time, keeping people healthy and keeping them out of the hospitals for flu treatment supports our community and saves the hospital capacity for those that are ill from COVID-19. Flu shots don't prevent COVID-19, however, and we wouldn't want anyone to think that getting a flu shot inoculates them from this pandemic. The CDC recommends that everyone 6 months or older get a flu shot unless you have a medical indication to not do so. The flu virus typically circulates in late fall or early spring. While most people become ill from the flu recover without serious complications, some people who get the flu can be sick enough to be hospitalized. And some of us are particularly vulnerable to the flu. Younger kids, older adults, people who are pregnant, and those with chronic medical problems are most vulnerable. All the steps we've been taking to reduce the spread of COVID-19 certainly helps reduce the spread of the flu. Frequent hand washing, wearing a mask, and social distancing. If we remain diligent with these safety measures, we can continue to bring down the rate of COVID-19 and also help prevent the spread of the flu. Flu shots are widely available at urgent care centers, doctors' offices, and from our employers. And in addition, the St. Louis County Department of Public Health will be providing free flu shots this coming fall and winter. Those will be available at the John C. Murphy Public Health Center in Berkeley and also the South County Health Center in Sunset Hills. In addition, we'll also have pop-up locations for flu shots available throughout the county, and we'll be announcing those locations in the coming days. By the end of this week, the health department will also post a process on our website, stlcorona.com, to make an appointment for a flu shot, and that can be made simply by clicking on the testing tab on stlcorona.com. So before taking questions, I'd like to introduce our Director of Public Health, Emily Doucette, who will be giving me a flu shot just to show how easy this actually is. All right. Here?
Yeah, got it. Yep.
All right. Work my way up here. Perfect. High enough?
That's perfect.
All right, I'll try not to jump. Oh. Okay.
Get your Band-Aid.
There's no call.
There you go.
Thank you. That's easy. Okay, thank you. Be glad to take any questions. Anyone? Doug?
Dr. Page, it's the biggest topic right now. I want to talk to you about youth sports a little bit, if you don't mind. Can you talk a little bit? I know there was a statement that came out from the task force last night that said at this point they have no indication or no evidence of any type of COVID case that would have been transmissible through youth sports. So the question we're hearing from people is why do these high contact and moderate contact sports continue to not allow to compete in tournaments and games?
Well, first of all, we recognize that the Youth Sports Task Force is meeting with our Department of Public Health again today and has supported and agreed with the guidelines that we have produced. So I appreciate their comments, But the guidelines that we have produced by Department of Public Health have been supported and agreed to by this task force. They certainly expressed frustration that they haven't been able to meet with me directly, like all all advocacy groups, and I respect that frustration, but I can't meet with everyone. And they're working closely with our public health department, and we're grateful for their support. They may not be aware of all the information that the Department of Public Health has, but we do have different teams who have been quarantined because of COVID-19 infections among their players. We do have evidence of transmission of COVID-19 among different teams from practices, even though competition of high contact sports has not started yet in St. Louis County. So we don't necessarily present all of our data to all of our advocacy groups, but we do depend on them for their cooperation and their support in helping us provide these guidelines. There is always a theme whenever we have new public health orders that a particular group feels like they're being picked on. And that's certainly the case here. And I feel their frustration. But we have a global pandemic. We have a pandemic in our community. We have businesses that have that are operating under limited capacity. We have people who have lost their jobs. We have people who have lost their lives. People who have family members who are sick. And our whole community has been affected by all of this. Across the nation, 37 states have either moved their fall sports or altered them in some way. That is 70% of the states in our country. Our restrictions on some competitions in youth sports, only allowing them to compete in scrimmages, are thoughtful and are designed not to hurt the kids, but to protect the kids. They are less restrictive than the city of St. Louis. They are less restrictive than some things that are happening in the state of Illinois, and they're certainly consistent with what we're seeing across the country. We have a strong and vibrant youth sports community in the St. Louis region, and we're proud of that. And they're as frustrated as every other interest group who's been affected by this pandemic, and we do hear their frustration.
We hear a lot about transparency or lack thereof from parents, fans, athletes, things like that. Is there any plan in place or anything like that to maybe provide more information up to date for those parents to ease those concerns?
Well, I would just refer you back to what I just said about the data, that 20%, there's a 20% positivity rate in the 15 to 19-year-old age group. We know that this is an airborne virus, and that any time people come together in groups, they will spread. We do know that we have infections from team activities and practices. We know that this is an airborne virus. We do not think it's reasonable to let people compete in groups. We're taking a similar approach to 37 other states, that we will not support letting people come together and spread the virus to see what happens. As far as transparency goes, we hear that a lot because we cannot release individual health records, names and addresses of people who have COVID-19. But when someone does report a case, we follow up with contact tracing. We do know that there has been some pressure, and some peer pressure to not report infections or exposures to the Department of Public Health for fear that it would lead to quarantine of youth sports. Well, I don't think that's a prudent practice.
And you hear a lot from parents or fans saying, oh, just across the river, St. Charles County, they're playing sports and they're doing this and that with social distancing and masks and things like that. What's different from over here?
I think what's different from over here is that we've taken a different approach from the beginning. We were hit harder with COVID-19 from the beginning, and we're in a better place in our community because we've taken a different approach. You can look across the river, or you can look in the other direction towards the city of St. Louis or towards Illinois, and we're all going to take a different approach. The approach we've taken here in St. Louis County is to protect the kids first. Our first priority will be getting our younger kids back into school, and then the older kids, when we believe it's safe to do so, we'll support that. We have we're going to work on those priorities first. And we're not going to support putting our older kids at risk with a population of 15 to 17-year-olds that has a 5-time greater risk of COVID-19 than the younger adults based on what we've seen in our data. And we believe we've made the right decision based on our public health experts.
And sorry, someone else has one, feel free to jump in, but as we move kind of towards flu season, I know, I'm sure, just germs are going to be intermingled a lot more often. Do you have any concerns as we move forward, just based on kind of where we're at now, or kind of what are your thoughts on that?
Concerns about flu season?
Well, just flu season mixed with COVID and just kind of
Well,
possible
absolutely,
cases.
that's what we're talking about here today.
Right.
This is, flu is always a challenge to our community. It always provides an influx of people who are sick into the hospital, and that on top of the influx we already have from COVID-19 will stress our hospitals. And even the COVID-19 infections are continuing to grow in our community. They're relatively stable in St. Louis County, but we'll be providing medical care for the rest of the state and the community here in the county, so we have to be ready for that and prepared for that. We're watching the pandemic task force numbers very closely. We know that we need to work extra diligently this fall to make sure that we get our community vaccinated for the flu, that we do everything possible to see if we can limit the spread of the flu in our community, because flu plus COVID will stress our hospitals, will overwhelm our hospitals, and will put at risk people who are coming to the hospital for routine medical care for strokes and heart attacks.
Have you guys added any extra resources or measures or anything just to be able to, battle a possible bad case scenario of, both flu and COVID popping up?
The best thing we can do to battle flu is an unprecedented effort to immunize our community, and that's what you're going to see. Battling flu after it hits does not go well. We need to be immunized for the flu. We need to get everyone to get their flu shot. It's difficult when people are working remotely, so our employers are already working to set up unique and different ways to provide flu shots to their employees.
One question I had when you were talking about the data as it relates to youth sports, why then is there a discrepancy between the data that your health department is analyzing and basing decisions off of and the data that this task force admits that they don't see what you're seeing in it? What do you chalk out that discrepancy to?
Well, they don't have access to the same data that our health department does. They're certainly welcome to work with the health department. Generally, our health department has access to a lot of information. I hope that partnership continues. It is a very diverse task force with very diverse opinions, some more vocal than others. But I think we should step back and recognize that they have not disagreed that our guidelines are appropriate, that the guidelines that we have initiated and promulgated for youth sports, we're all in agreement that that's the right thing to do. What we're talking about is whether or not they have access to all the data that we do, or whether or not we describe the situation the same way that some of their members might describe it. But the conclusions of restrictions on some competitions of some sports for older kids are the same.
So are you optimistic at all, as is the task force, that we will see any kind of high contact sport competition this fall? I think these people just kind of want an answer. I know you can't give them one, but
Everybody wants an answer to every challenge that we have with this pandemic, and we are sensitive to that. And we're sensitive to that frustration. This touches everyone's lives in one way or another, and a lot of things aren't going to be normal this fall, but we're going to work with our sports community and our youth sports community to do what we think is safe to protect the kids, and that will be our top priority, and to get as much of sports activity going as possible for skill development, and to get as much competitions going as we believe that is safe. We've taken a more conservative approach to protect our kids than some parts of the state, but it's more consistent with the rest of the country. And that's the approach we're going to continue to take. We will continue to follow the advice of our medical experts and our public health experts in all of our guidelines that we propose in St. Louis County.
My last question for you, you already addressed it a little bit, talking about you understand their frustration with not being able to always speak with them on their weekly basis during their discussions, wherever it may be. As the face of all of this, and ultimately they've said the decision is up to you, are you going to make more of a concentrated effort to be a part of those discussions? Do you think you need to be physically at the table?
Although this is something that has been on the top of mind of a lot of folks for the past 5 days or so, there are many activities going on related to this pandemic, and there are many activities of county government that take my time, and I will not be meeting with the task force. Our public health officials, our public health experts are well suited to do that. They meet on a weekly basis. They converse more than that, and I think they're working together like they have with every other industry group that's been affected by the pandemic. And I think our health department's doing a really good job. Any other questions? Okay, thank you. Please get your flu shot.